Welcome, guys, to another episode of the EB2NIW Podcast. Today, I'm talking to an amazing public health expert. You're going to learn all about her. She just recently got her EB2NIW application approved. And today, we want to learn about what made her application stand out. All right, so today, I'm going to introduce you to Miss Tari Ajay. And she's going to tell us all about her journey. Welcome, Tari.
Thank you so much for having me.
All right, so we want to hear so much. Like I'm sure a lot of people have a lot of questions, especially people in the public health, sphere, right? People who are in the public health sector. I'm sure they want to know so much about what made your application stand out, and we'll get to that. But let's start a little bit with why America? Like when you thought about coming to the U.S. for school, or work, why was it the U.S. that you thought about? Like, is it that you had, parents who had gone to the U.S. for their education, or was it just, it's a thing to do?
Sure. So my journey here was interesting.
Right.
I'm Nigerian, so I grew up in Nigeria till I was 13. And then my mom got transferred to the Netherlands, so we moved to Europe for a few years. So I was in high school there, and at the end of high school, figuring out where to go to college,
Right.
We were initially very interested in going in Canada from the start. I have an aunt who lives in the US, so that was always one of the options.
Right.
But initially, we were very more so geared toward Canada because we had a lot of friends and family members who had moved from my school in the Netherlands to Canada. So we had a base there, and we were very interested in doing that. But it didn't work out. I'm a twin, so my sister and I were applying at the same time. And so we were trying to figure out where we could both go together. And America just worked out. So we got into the same school. We got into very different programs, but in the same school. So we knew that we were able to live together and move together. So yeah, it just made sense in the beginning.
Yeah. So that's interesting. I love that you came with your sister, right? Your twin. That's even much better. I know a lot of times when people make that transition when they move, you're just by yourself. And so I feel like coming with your twin must have made it less of a culture shock for you, right?
I mean, even though I did have like an inbuilt support system. We were each other's support system.
Right.
It still was definitely much a culture shock. Like, we had visited the US at that point once, and my aunt lives in Vegas, so we had gone to Vegas, which is completely different from anything that we had known or seen and experienced.
Right.
And we never visited our college campus when we were picking. We picked based on, it looks nice, it looks slightly smaller, because we didn't know really anything about that. We went to school in Pennsylvania, Penn State, and we picked one of the smaller campuses because, my mom initially thought the bigger ones would be overwhelming. So it was like, let's go something smaller. So it was a tremendous shock because our school was so small that it was just a highway bisecting the campus. So there was literally the dorms on one side, the school on the other side, and it was that was the whole town. So it was a huge, massive shock for us moving here initially.
Okay, so I'm guessing, you've talked about one, culture shock. Was that the biggest thing that, struck you about the U.S.? For me, I moved to the U.S. for school as well back in the day. And I think I had watched enough Hollywood movies. I had watched enough Hollywood movies. And I think I had these high expectations of high-rise buildings everywhere. And then I landed in LA and I was like, oh my God, there's a ton of, it's dirt on the road. It's not what I pictured. I think for me that was huge. So for you, what was the thing that made you pause, I think, in terms of culture shock? What was that one thing that stood out for you?
I think, as you mentioned, a lot of my idea of America was very much shaped by movies,
right?
Especially high school movies, and going to college for the first time is completely different. In Holland, we were more accustomed to a situation where we were in an international school, so everyone was new.
Yeah.
So everyone was invested in forming relationships and forming friendships.
Right.
But we went to a campus where we were one of 5 international students who were starting in that semester. So
oh no.
Everyone was just like, who are these people? And we moved to a campus where it was predominantly white. So that particular campus was a forestry campus. So it was a lot of white people like interested in trees and plants. And
yeah.
Then there's these two Nigerian girls who have British accents because we went to a school that was international. And so it was just like everywhere we went, it was like, who are you? And why are you here? How did you end up here in the middle of nowhere, basically? So it was a very big shock. Like, there were no cars, there was no transportation system really in that space. We didn't drive, so it was just like we're really stuck on campus for the most part.
What town was that in? College?
It was in Montalto, Pennsylvania, which is like 2 or 3 hours away from Harrisburg, the capital.
Oh, okay. Oh yeah, I've been to Harrisburg for a conference. Yeah. So tell me a little bit about your educational, history. I know that you moved to the U.S. for college, right? So this wasn't grad school like most people would. Yes. Okay. So what did you study, and why that?
Okay, so initially I was very interested. I thought I was going to go to med school. I thought I was going to be a doctor. So I wanted a campus where I could do pre-med without doing pre-med. So I was initially going to do a pre-med major. My mom was like, we're not doing that. In case you decide in the future that you don't want to go that route, which I'm very grateful for now, you need to have an actual degree that's not just pre-med.
Right.
So my initial degree was in biology. So it was biological and physical sciences, which I then switched to general science. So I did a bit of everything. I did all of the regular hard sciences, did soft sciences, did meteorology, anthropology. I just was very interested in figuring out what I like to do. And my junior year, I took a health policy class. Okay. And from the very first week, I was like, yeah, this is what I want to do. At that point, I had already bought like the MCAT books. I was about to start the process of studying, and I was just like, yeah, I don't want to do that. This is what I want to do.
Right.
So I knew I was going to go to grad school right out of college, but I just didn't know what I wanted to do at that point. So when I started researching, I'm like, public health, this is where I want to go, and this is how I want to contribute to the healthcare field. And that was it for me.
Okay.
And I haven't looked back since then.
That's amazing. So you graduate from college, you go do your MPH, Master's in Public Health. At this point, can you tell me, had you heard about EB2NIW? Because when I met you and I heard what you're working on, I felt like, oh my God, this is perfect for EB2. But did you know about EB2, or this was just purely you going after something you just really loved?
So at that point I had heard, I didn't know what it was called. So I had heard that there was a green card that you could apply to after you got a PhD. So I knew it as the PhD green card.
Right.
That's all I heard. I didn't know anything more than that. I'd never researched it until 2020. Because of COVID, like, you're inside a lot more, you're doing more research. And my sister actually found your page and sent your information to me, and we're just looking at it and we're talking about it. And we're just like, the time isn't right. It's like, it's a PhD thing. I thought I would do a PhD at some point, but I just wasn't really interested at that point. But it was just, I didn't really know anything about it until I spoke to you.
Right.
For the first time.
Okay, so that plays out really well, because when I spoke to you and you talked about the work that you have done with maternal, maternity, and things like that in the U.S., I knew right away that was an area of merit that had incredible merit and national importance for the U.S. So, just starting the process, you say you don't have a PhD, but I was quite impressed with your profile, right? Do you want to walk us through some of those achievements that you had in place, so that if someone was out there with a similar profile, they'd be like, yeah, I feel like I fit into this. So let's talk about scholarships. Did you have any scholarships at the time? Do you have any awards? What did that look like?
Sure. So as I mentioned, like, once I picked public health, I kind of just like, this is what I'm going to do. So I got to grad school, I put my head down, and I enjoyed it so much that everything else just kind of followed down like the path. So my first semester there is a annual public health conference every year, and my school would sponsor second year MPH students to go to the conference. I was a first year, I was like, no way I'm going to get this, but you know what? I'm just going to apply. Why not? And so I applied for the scholarship. I got it my first semester, and the conference was for, I believe, October, and this was like in June or July. So I was very excited. So that was the first scholarship I ever got for the school. And then there's also a merit-based scholarship that you can apply to every semester from your second semester, which, again, at that point, I didn't really think I qualified for, but I was like, you know what, why not? So I applied for that. I got my first scholarship that year. The next semester, I applied for the same scholarship. I got it again. I applied for the conference scholarship again, which I also, this time I applied for the scholarship with the actual Public Health Association, so not from my school. Not from your school. I applied as a student, and I got that one as well. And I also got a scholarship from my school. From some of the alumni have a scholarship that they award to 2 students who show a lot of promise in the public health field, which I didn't apply for. I didn't even know that I got it. And I received an email one day from my professor saying, we put you in for this and you got the scholarship. Right. And the last one I received was also from the Public Health Association. I got a scholarship to attend. They have a Policy Action Institute every year, so I applied for that. Okay. And this was, I had graduated at that point. I was already working at that point. I applied for that one too, and I got that as well. Yeah. So
it just sounds like
a lot of
applications, right? and that's something that people need to know, especially people who are still in school right now and listening to this, right? Is that you have to put yourself out there, right? You have to apply for those things. I mean, you got a couple of things because people saw the promise and said, hey, she needs to be nominated for this. But most of the stuff I'm hearing you say you applied. And so that's something that I just want people to, be aware of is put yourself out there. Whether you've heard about EB2 or you haven't heard about EB2, just for your career, it's always good to be part of what's going on in your field. Okay, so we talked about scholarships. How about like relevant volunteering? Were you putting yourself? I know you reviewed abstracts, right? So tell me about that.
So as we just mentioned, applying and putting yourself out there. Even I think my favorite, the thing that started me like doing all those applications is that if you don't ask, the answer will always be no.
No, yeah.
So you're not sure. You're not, you might not qualify, you don't think you qualify, but you can just, you always put yourself out there. So with the abstracting, it's the same thing. The semester, a few months after I had graduated, I was just like, I'm not sure that I qualify yet as an expert, but you know what, the opportunity came up to be a reviewer for the abstracts for the upcoming conference. I was like, you know what, why not? So I applied. I got selected like right away, and I reviewed a few abstracts for that year. A couple of them that I reviewed, I think, ended up getting selected for the conference that year. And it was a mix of posters and actual presentations, and it was interesting to do. I'm like, why not? Like, this is another way to give back to the field, and also to keep abreast with the research that's coming up, because public health is a very research-heavy field, and you really always want to know what's going on in the public health sphere. Yeah. So I did that a few times. I really enjoyed doing it. This year I'm reviewing videos this year they have like a video competition as well. So I'm doing that as well this year.
So that's interesting to know that you're still, even after you've gotten your green card, this is the amazing thing about working with people who are exceptional and doing things that America needs is, one thing I can pick out is you're not just doing this for the green card. A lot of times it's people who are already doing the work. And even way after they get the green card and I reach back out to them, you guys are still doing the same thing, right? And so it's amazing to hear that you're still out there giving back and doing all this relevant volunteering. I think that's really good. Good job.
Absolutely.
All right, let's talk about what you proposed. I think a lot of people want to hear that. So you're in your public health program. You're thinking about, was this project assigned to you, or did you have a choice in, hey, what am I going to research for my public health, research project?
Okay, so as I mentioned, like public health or something, like once I found it, I knew this is what I wanted to do.
Right.
But public health is a very broad field. Yeah. Like you can do a lot of things with public health. And going out or coming in like to the field, I really didn't know what I wanted to focus on. Okay. Before that, as an undergraduate, I had gone back home to Nigeria for summer and I volunteered at a healthcare center close to where I lived. And I worked with the maternal unit and the child unit, and I knew that I didn't want to do anything with kids because I just didn't think I had the makeup for that. But I always knew that I wanted to do something in the space with maternal health.
Right.
And so now to school and starting my degree, I applied to be a research assistant for one of my professors. And again, like the way I applied to be a research assistant with the professor, he was like, I don't think that we will be a good fit, but another of the professors is looking for someone. So I will send your resume to her and just talk to her and we'll see like if that works out for you.
Okay.
So I spoke with her, and from the very first meeting, like it was a match made in heaven, like a match made in professional heaven. Like it was, we got on so well, like till today we're still really close and we still talk all the time. And she, just like me, had a lot of interest in public health. She came to the field later in life, so she really knew that she was passionate about this work and she wanted to do everything. And my job was to make sure that I could allow her to do everything by keeping track of everything that she was doing.
Right.
So every new project that she started, I was on it. I had my fingers in everything that she was doing. From she did a lot of work with child sleep and sleep safety, but also she did work with maternal health, work with just health education in general. So doing that work with her, like she really wanted to set up a nonprofit organization. So it was my job to figure out how to get that going. And that's really what pushed me into maternal health fully, because up until that point, I like had some experience. I knew that it was an interesting field, but that really set the stage for like everything maternal health in my life going forward. So doing that, setting up that organization for her, and then going on to think about my project, she was like, why not just, as part of your work here with us, and as part of my internship, just do some interviews and talk to a few people. So that was what birthed my project. I spoke with a lot of women like giving birth in our community, and just what I was hearing was just not great. Like it was terrible. And I just like, this is where I know that I need to be doing work. And at that time, it was a great, like our community on Long Island was a very nice, wealthy community that had great rates for maternal mortality when they're not stratified by race. So everything looks pretty when you don't dig in deep of what's going on. So hearing that and seeing that firsthand really was what made me know that this is what I wanted to do, at least for that time. But I knew that I always wanted to be involved in it in some way, shape, or form moving forward.
Yeah. Okay. So it sounds like you decided to, for the EB2NIW application, your proposed endeavor was more to apply your expertise in public health to address the problem of, health disparities in maternal mortality, right? And as soon as I heard you talk about that, I could connect with it because I've had 2 kids. And even when I had my kids, it wasn't that blatant, like, we're going to not give you medicine because you're Black. You know what I mean? I think it was more subtle. I mean, when I went into labor, went in the hospital, I didn't even find a nurse that was Black for the longest time. I was in labor for hours, And at first, I was just one of those people that when I came to the US, I didn't really understand what the problem was. And so I said, you know what, I don't mind if my doctor is not Black. I don't mind if, it doesn't matter as long as they're qualified. That's what I went with.
Yeah. Yes.
But I realized something. When you're in pain, you need to see someone that looks like you, period.
Absolutely.
This is it. And then I'm telling this to all of you guys out there who are going to be having babies soon. If you're not going to, you have your mom there, have your sister there. You need to see someone that looks like you because you need to be able to find someone in the room that can relate to what you're going through. And I had all these lovely nurses come in and they were just trying. I felt like I was making conversation the whole time. I felt like every 6 hours, I felt like I was meeting somebody new and just making conversation. And at some point I told my husband, oh my God, there's no Black person here, And then from nowhere, this nurse, I never forget her name is Chevy. She walked in. By this time I was like 30 hours into labor, and she walked in, and as soon as our eyes connected, I said, "You're Black," and she was like, "Yes." I said, "Where have you been?" And the next word she said, "I'm gonna take care of you." She said, "I've had kids," it just brought a whole level of peace to me. And just talking about it, I even get goosebumps, like just talking about it, because I connected with this lady I had never met from anywhere. And it felt like I had a sister, someone that could advocate for me. She told me, I'll take care of you. You know, it was, and people have been telling me that all day, but it never connected. And so later on, when I was talking about this whole experience with some other doctor, he's also Caucasian. He was saying to me, there's research that shows that people have better outcomes when they see people that look just like them. Even if those people never physically administer anything to them, just having someone there that can connect with your pain, that looks like you, it goes a long way. And so as soon as I heard you talk about that project, I knew that that was something that was going to, you know, anyone who heard that, just looking at the stats, Black women have poorer outcomes, not just Black women, women of color, period, right? It's just, it's staggering. And it doesn't matter how educated you are. I was having my baby in a hospital where I had worked, in an institution where I would work. They had to break the glass multiple times just to look at my records. So I wasn't in a place where no one knew me, right? But I still felt that need to have someone that looked like me. So I think that that project that you picked for your national interest waiver application was excellent. So you're in this environment where you don't necessarily have, even though it's like a more affluent area, you're saying that you still had the problem of health disparities when it came to, you know, having babies, basically, to break this down. So what measures were you proposing to put in place to actually help with this? You know, were there initiatives that you were already working on, that you were proposing? What is it that you were proposing to do about this problem that the US has?
Yeah, so as you just mentioned, like having someone like in the room that looks like you is just, it makes a lot of difference for a lot of people. And as I mentioned, like speaking with the people, every single person I spoke to had exactly the same experience as you did. And this, like, the range goes from people who have no education at all and who like are high school graduates, all the way to someone who was a practicing lawyer at that point, who had worked with the hospital, with the health system, who lived in a nice area, who went to a hospital in a very nice area, still experiencing the same thing. And so like with that research, with everything else I was doing, I was seeing in person, like, because after then, like, I went on to work in a hospital, I was seeing this, like, firsthand. Like, this, no one had to tell me this, and I was seeing it. And so it's just, like, I wanted to do or continue to be involved with work that ensured that people had an advocate. So, like, that was the big part. Like, as you said, when you're in pain, you don't want to be making conversation with people. You don't want to, like, be advocating for yourself. And sometimes, you know, when you're in pain, like, you're just so out of it that you don't even know what you need in that moment. And having someone else who is in the room that's like, okay, this is what she planned, this is what will happen, and I'm gonna find a way to ensure that they stick to everything that you have planned and you have proposed for your birth. Even when things go south, you know, you still need someone who's like, okay, this is what I know she will want, so this is what we're going to do. It's so important to have an advocate. And part of the work that I did is called the Birth Stresses Warriors. That's the organization that I work for. Still running even till today. The majority of the work that we started doing and that's continued to be done now is with education. So like with people not knowing, like, as I said, when I first heard the statistics, I lived in that community. I didn't know that was a problem. Like, I was shocked the first time, and every single person that we talked to, even Black mothers who would have the same experience, we were shocked by what the statistics were, because I think that with this experience, especially like with giving birth when you're Black or giving birth when you're a woman of color, it feels like a very solitary experience. It feels like you're the only one that's dealing with it. No one else has dealt with it. You don't feel like other people understand what's going on. But this is not an isolated experience. A lot of people are dealing with the same things. So it's really figuring out how to solve this problem on a systematic level and being able to educate people about the statistics, but also being able to educate people in a way that you have to be more culturally competent when you're dealing with people who don't look like you. So if you're not going to understand what these people's fears and problems are with the system already, you don't know how to react to them. And so you treat them like you treat everyone else, and that's causing them to have worse outcomes across the board. And so you need to be able to work with your entire patient population. And so we're doing a lot of education, but also trying to find practitioners who are able to be champions in their fields and tell people, listen, this is what we need to be doing. Yeah. And also designating organizations and community-based organizations who are like, we're going to advocate for people. This is how we're going to get it done.
Right.
We're going to also go all the way up to all the highest standards of government to get people whose voices heard. Yeah. So you need to do every single thing because you can't just do one thing. Nothing works in isolation. It has to go all across the board. So that's really the work that I propose to do to help with. And after I put in my application, I got nominated to a perinatal advisory board in that community, even though I don't live there anymore, but still that community that I came up in maternal health. And really our job is to figure out how can we do this work in this community with the resources that we have, or what extra resources do we need, and what do these programs look like in all spheres of all the work that I just mentioned. And most recently, what I also have been talking with them about, from my perspective too, is the immigrant perspective. As you mentioned, like, not every immigrant looks the same.
Exactly.
And so we all...
Oh my goodness, I could talk a lot about that, but go ahead.
Yes, and we all have different needs, but we all need to be represented within the system. So that's the perspective that I'm bringing to this board, is really to ensure that the immigrant voices are heard, because it's a very lonely experience sometimes being an immigrant, because you don't know how much to share.
Exactly.
You don't know what you can talk about, what you can't talk about. You don't know what systems and services are available to you, and so you just kind of deal with everything by yourself. Right. And I really want to be like a voice and an advocate for people who are immigrants that maybe don't look like me, but also the immigrants that look like me, who are maybe have different paths to the country and who have different paths within the country, and who also need to be advocated for as well.
I love that you brought that up, because every time I went to my doctor, I said to her, I'm Black. I would remind her, I say, Black women have the worst outcomes when it comes to, she's like, can you calm down? I was like, yeah, you need to hear it. Like, I don't know, sometimes, because I said, it's my job to advocate for myself. I'll keep reminding you. And, you know, because I also had like pre-existing, like, what's it called? White coat syndrome. It's like when you go to the hospital and you have high blood pressure. Yeah.
I have that as well.
That should not be toyed with, because when you get pregnant, it's one very big predisposing factor to getting preeclampsia. And I ended up with that the first time, right? But I was always saying to her, I said, look at the stats. She's like, I know this. I promise you I know this. I kept telling her, because, hey, I'm my own advocate, okay? And, you know, I know that in the immigrant community, especially like, you know, those who came in for school, just from my own experience, there are times when some of us needed like mental health services. I'm talking from experience, just living on campus with grad students. Getting a degree in America is tough, especially when you're from outside, because you're dealing with that experience of trying to get that degree, but then there's all these outside factors pulling at you. And so I remember sitting with one of my friends, and she was like, I really want to go to she called it a shrink at the time, but she needed like a therapist. She's like, I really want to talk to someone, but I'm scared that this is going to show up on my professional profile. Like, if they look me up, they'll see that I've gone to the, we have all these, we don't know what the resources available, what can be kept confidential, and so you try not to upset any systems, and you don't know what to do. And so I think it's important that we're having these conversations so that people out there know what their options are. They know how they can help. A lot of people think, it's left to the doctors, to the OBs, right? OBGYNs to do all the work when it comes to maternal health. No. Just working with you, I realized that public health advocates, they're not MDs, but they do so much for the communities. They're the ones who are translating all these wonderful things that we're putting in papers, which no one is reading in the community, right? You guys are taking that stuff and you're applying it. You're saying, hey, you guys, pay attention to this stuff. Because in my field, we're so busy in the lab doing experiments and writing papers that people in the community are not reading. Only people who are in the scientific world, like we are reading these papers, right? So you guys do so much. And I just want to thank you for that, because that's something that is bridging the gap, and every day people are beginning to be aware of it, that, this is a Black mother. Her baseline her numbers are high for preeclampsia. We think you should pay attention to that. You know what I mean? Like, everywhere I went to and I said all those things I was saying, people were saying, hey, we're going to pay attention. Don't worry, we're going to take care of you. So I think it's important that people know these things. All right. So one other thing that you mentioned, I thought that was really impressive, was the fact that she had mentors. And can you speak about the importance of mentors, not just for the EB2, maybe for the EB2NIW process, because you need mentors who are going to recommend you, but can you speak about the importance of mentors in general when it comes to advancement in your career?
Absolutely. So public health traditionally follows a very apprenticeship model, where you, depending on the level, especially from master's to PhD and your terminal degrees, you kind of tend to focus on the work and the research that your apprentice is doing. So a lot of programs won't even admit you if you don't have someone who you connect with whose research that you will be interested in furthering.
Yeah.
So going into that, when I first entered the field, I didn't really recognize that this was the thing, but being involved in the field a little more showed me like that tended to be with the case, because like even people I entered the program with, depending on what professor you're working with, your experiences tended to vary a little bit. So I enjoyed that system, but I think it's a slight drawback. So like the mentorship is definitely a very important part of that system, but also outside of that. So the mentorship, I will say, apart from the apprenticeship model, is a very incredible part of public health, where you can come into a situation with people who will continue to be with you throughout your professional career.
Right.
As you mentioned, it's very important to have someone who can point you in the direction of opportunities, but also someone who can hold your hand through those opportunities, and also who you can talk to very freely about your professional work. Because a lot of the times, things that we're experiencing, you can't really translate it to people who are not within your field, because they might not fully understand what you're talking about. And peers as well, like your peers are the most important relationship, and it's very important to build relationships with people who you're in school with, who you work with, but also having an extra level of someone who is like, maybe do this like this, or don't do this like that, or who you can talk to about the things that you are facing or struggling with is very important. And because of that, that also like showed me an extra step of how I wanted to give back too. I enjoy talking with people, talking to new people, and ensuring that my experience, which was not necessarily terrible, but my experience is not the experience that anyone else after me has. So like the whole point of going through my life professionally and otherwise so now is important to show that other people that this is possible, but also how can I help you achieve this quicker than I did? So I do that now. I'm part of the alumni association at my school, and I'm currently creating a mentorship program. But even outside of that, every international student who comes to my school now, my mentor, as I mentioned, we're still very much in contact. She will send me their information right away. She's like, talk to them, talk to Tari. Like, she will help you get situated. She will help you get settled. And it's very important to have someone, even as an international student, like outside of an actual professional mentor, having someone who can tell you how to get a social security card, tells you how to open a bank account, where to look for housing, where to look for what health insurance to use, all these things that no one really takes the time out to tell you about. It's so important to have that throughout your career, because it's really so helpful.
Yeah, it is really important. Okay, so you had the right mentors, and you're working to make things better for people who are going to come after you. But how did you choose your recommenders? Because we know recommendation letters is a big part of this process. How did you go about picking who was going to recommend you for this process? I mean, how many did you have, and how did you pick them?
Absolutely. So I had 5 going in. I had a few other people who I eventually reached out to, even after I had submitted, who were willing to do offer a recommendation if the need arose. But I went with 5, and I would say the 5 people I picked are people who I've trusted a lot of my professional career with providing recommendations. So one of them was my mentor. Another person was someone who I met through a mentor, who also I worked on a project with her. I picked someone who was my boss. and who could speak to my accomplishments, who could speak to my work, my contributions, and who also had enough professional clout to say what was important about the work I was doing in the field. And I also picked two people who were my peers. So one of them just so happens to be a medical doctor, but we were peers and we worked side by side on a few projects. Okay. Another person who I met through my program who also worked with me at work. So as I said, peer relationships are also very important. I think a lot of the times we focus on building vertical relationships and we forget that people who are next to us are also very, very important to where we're headed. So it's important to develop all relationships, not just people who are higher
than you are. Okay, that's a really good one. So now you've got your recommendation letters. I mean, you guys, if you've made it to this far in the podcast, you can tell that Tari is well-spoken, very educated, and obviously can write her petition herself. So I'm even curious to ask you, Tari, why did you have us write your petition? I know that we offer these editorial services to help people come up with really convincing petitions based on what they're doing, especially people who are busy. But why did you decide to outsource that? I know you could write that yourself. Even when I had the consultation with you, I felt like, she could write this herself. So why did you decide that, you know what, I'm going to give it to someone else to do it?
I think that the most important thing for me at the time was that because I wasn't very familiar with the process, I wanted someone who really understood what the process was and what the requirements are. Right. As anyone who's a good writer knows that you need to fully understand what is expected of you when you're writing anything. Right. Mm-hmm. So you need to be able to communicate properly with your audience. You need to be able to give exactly what is expected of you. And I knew that doing it myself, I probably wouldn't be the best person to articulate everything that I had done, but also articulate properly with this particular audience. Right. And so I wanted someone who fully understood everything that was expected. Mm-hmm. And also, like, when something this important is on the line, like, you really want someone who is more level-headed and who is able to be objective about your work and not just you. So like when you're writing about yourself, it's very easy to be more subjective and you're trying so hard to pick apart all the little things that you've done and you haven't done and you're not really sure what's important and what isn't. Yeah. But having an objective eye on your work is so important because I don't think I could have made it through this process without you. Like it was
I wouldn't take that much glory for it, but I think you did the work, Tari, and I have to tell you that. You'd already done the work. It was just for me to just write up, summarize, okay, this is all she's done. How can we put it together? So it's more of we just representing what you really wanted. You know what I mean? Absolutely. So I think that, but I always wondered because I'm like, she's, I get that some people are busy, some people have a lot going on, but why did she pick us to write it? I'm really happy to hear that. One of the things that we do is, when we take on cases to write the, your editorial part of the story, we discuss with our team, what we're writing about. And so one person will take up the case and just like give everyone a brief, like, okay, this is Tari, she's blah, 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 So when every time someone gets approved, we share it with the team and everyone gets excited. So I remember just telling, when you had gotten approved and you sent me a message, I remember telling my team it was a WhatsApp text. I was like, hey, you guys, Tari just got approved. And every single person knew what you did. You know what I mean? There are times when I say, I just put a name out and people are like, I don't remember that. Because sometimes I just work on stuff exclusively. But I just remember everyone saying, yeah, she had a really good profile. You know what I mean? So it was much more about what you had done than us just putting words together on paper. So I was excited to write that, especially because I also felt connected to your story. So you had chosen us to write this thing for you. At the time, I don't think there was any premium processing happening. No. So you turned in your application. I think it's important to mention that you had graduated from your MPH program at the time. It was during your OPT. Can you touch a little bit on what you were doing for your OPT? Was it exactly what you had proposed? Because people have that question. They feel like they have to propose whatever it is they're doing for their OPT or their work. Did you feel like you had to propose what you were working on at that time, or the work that you continued the work that you had done during your MPH?
So at the time, I had already finished like my OPT job and I was back in school again on the F1. So in my final few days of getting another master's in project management. But as you mentioned, it was the work that I did after my MPH was very much not in maternal health. So I did work in quality improvement, and I worked in the geriatric population. So like I work with older adults. So that's the work I was doing after. And quality improvement is completely different from anything I had done before. But in its spirit, because of the project I was working on was what they call demonstration project. It was funded by the Center for Medicaid and Medicare Services, and it was a project implementation, so which is also a big part of public health. Yeah. So I was still within the field, just slightly removed from the work I did, and that was that I applied my petition based on. And so, and now I'm doing project management, which again is is very different from actual public health. So no, it doesn't really matter if you are you're currently working in that. I mean, I will always have my hand in maternal health. I said I'm on the advisory board now. If an opportunity ever came up to fully transition back into that field, I would do it in a heartbeat. And I continue to stay in that space. I'm not currently working on research now, but once I'm done, I do plan to do some more research within the field. I still, as you mentioned, maintain my membership of the Public Health Association, even though I've added compliance to, and I'm doing both right now. But it's important that you explore your interests. Like any interest that you have is important, and you can always find a way to tie that into the work that you're doing, and also into the work that you propose to do in the future.
Yeah, and I think that's really crucial, because we did mention that you had done other things, right? So when you pick what you're going to propose, it doesn't matter if you're not doing that full time, because it's a proposed endeavor, right? We talked about these other experiences that you had when we mentioned that you're well positioned to advance the endeavor. We said, the fact that she's been successful in other things shows that she actually has what it takes to succeed, right? As an expert in your field, you're not only going to be stuck doing one thing. You're going to find yourself doing all kinds of things, but you have the background for it. You have the platform that you need to be able to tackle any public health problem, right? And so it's important that you still can use the experience, whatever other experience that you have, as evidence that you're well positioned. So I think that's really, really good. All right. So do you believe in this pathway for immigration do you believe that this is a worthy pathway for immigration? What do you think about that?
I definitely think that it's worthy. Another part of that I didn't fully articulate when we're talking about why I picked your services is that when from that first meeting, before I spoke with you,
I remember you came with your sister. I remember that.
Yes.
There was someone else on the call.
Yes, I did.
And I remember thinking, oh my God, there's someone here who's been invited to see if I'm a fraud. I better be careful, I remember thinking that. And she was just like, I'm here. She was working on her computer. She was like, I'm just here to make sure that Tari doesn't leave anything out. And then from time to time, she would, chime in and say, hey, Tari, you're forgetting your other experience. I was like, who is this person that's so invested in you that she knows everything that you've done? But that's your twin, right?
Yeah,
I was like, okay, maybe it's her sister who's gonna pay for this process. So I'm like, okay, it makes sense that maybe she wants to be part of it to make sure that this lady from Instagram is not a fraud. You know what I mean? So I remember that. I remember everything about every single client I speak to. I may not remember their names, but if I've worked on your petition, definitely remember your name. But I remember everything about the Zoom calls. I feel like that's something my brain just like, hey, I'm just not gonna let this go. So I think you guys made a big impression the first time. But go ahead.
Yeah. Okay. So I was just about to get to the reason why she was also with me on the call is that I had spoken to a few other attorneys at that point.
Okay.
Nothing really formal. Like emailed a few people. I had talked on the phone with a few people, and everyone was like, too young, not enough experience, not enough citations. It's not gonna work. Like, come back in a year or two. Like, you have a good background, but you need more experience. You need more. Right. We're not gonna be able to do that. And so, like, even scheduling that meeting and coming to that meeting, already I was at a place where I'm like, if this doesn't work out, like, I'm gonna figure out what's plan B, because I didn't really have a lot of
Other
hope
plans.
at that moment about everything that was going on.
Mm.
And just like speaking with you at that point, like the amount of validation that I got from that first phone call was one of the main things that like was like, okay, I can do this, we can get this done.
Right.
And that really pushed me to get everything together as quickly as I could.
That's good.
And you know, like speaking with you, which I've also found like as after I told you like if this works out, I would get everyone to come to you, which I have already started getting my entire circle to come to you, because it is very important that you hear from someone else that the things that you have done are relevant to the field and are relevant to the country. And so I think that this particular pathway is I think it's getting slightly more popular these days, but it's still like a field that, or a pathway that more people need to know about, because it is a way to validate all of the work that you have done by yourself. So you're not getting it through work, you're not getting it through being married, you're not getting it through any other way. This is solely based on your achievements and your accomplishments. Right. And there is no bigger validation than that to cap everything that you've gone through. As in, if anyone who's been like an international student knows the amount of stress and pressure that you're under and work that it is to be a student. And so to have something like this that's like, okay, we've seen everything that you've done, and we know that you can continue to do more, is such an important pathway for people.
Oh, thank you so much for sharing that. I mean, I feel like what makes it unique for me is I've been there. I've done that. You know what I mean? I've spoken to people who have said, hey, maybe come back in another year. I've had that experience as well. And I'm like, no, these are the requirements. I feel like I have what it takes. And there's so many misconceptions also tied to this process, right? And so during that consultation, I am unbiased because I don't really know this person from anywhere. But I look at the profile and I hear, okay, this is what I've done. And then I think about the requirements and see how can someone with this profile fit the requirement. And I think that for a lot of people, they think you have to have a PhD, but you don't have to have a PhD to apply. And that's one of the things that I realized is when I wrote my toolkit, because I had a PhD, it made people think that they needed to have one. And so that's why I said, I have to put it on social media. People have to know that, great, you have a PhD, you have a master's degree, you have a bachelor's degree. That's all good, but that's not the requirement. You know what I mean? Another thing people think is that you have to have publications and citations. There's a ton of them, right? Did you have publications and citations? How did that affect you?
I had one citation from a conference, and that's it. I don't have any other version of publications.
Right. But you see that didn't really draw you back. I think I always tell people, come from a place of your strength, right? If you don't have publications, why are you going to talk about publications first? Focus on the things that make your application strong, and then build it from there. So I really enjoyed. I remember again, like I told you, I remember every conversation. It's a good thing and a bad thing because it's stuck in my head, right? I remember getting off that call and I was talking to someone in my team and I said, Tari came with her sister, and I said to them, it's on. We have to make sure that this thing works, okay? Everybody has to make sure that they're editing right. Everybody has to make sure that we're bringing our A game to the table. We have to think of ways to, and we do that for every single person. I don't encourage everyone I speak to apply. No, it's not my job to do that. If I feel like, and again, it's my opinion, right? I'm not an immigration lawyer or anything. So I'm helping you more with the editorial side. But if I feel like, hey, you can do a little bit more, I'll tell you. I'll say, hey, go join professional societies. You're an expert. You should be sharing your knowledge with other people, right? We'll give you, go speak on a podcast. We think a lot more people need to hear about what you're doing. Or we'll say, hey, don't you have certifications in your field that can, show people that you're an expert in this field? So we would give people like tips and tricks and things that they can do to boost their profile. We're not just saying, hey, everybody come and apply just for the heck of it or just because we like to write. No, we really want to make sure that the people who are doing amazing work, that's the bottom line. I've met so many amazing people doing incredible things and who continue to do incredible things. It's not like people who come on the Zoom calls and say, hey, what can I propose? It's more like, how can I tell my story? And that's something that I love. every time I hear someone say, what can I propose? It's a red flag to me, because it tells me that you don't plan to continue that, right? And so when people say, what can I propose? I'm like, okay, well, let's start with what you do right now, you know? So thank you so much for sharing your story, Tari. This is amazing. I'm sure people who are out there who have MPH degrees, you know, who are thinking, is my degree enough? Have I done enough? Have I volunteered enough? This my scholarship that I have. This one citation I have from this conference that I went to. The review that I did for this journal, or this professional society. This program that I'm volunteering in, or, you know, all these little things. How is it going to count for the NIW process? Thank you for letting them know that it counts. And, you know, thank you for also recognizing that this type of green card, you know, just recognizes all the hard work that you've done. Okay, so what does the future look like? What are you interested in? What are you working on? You know, you've gotten you're well on your way to independence in America, obviously. What do you think? What do you feel like the future holds? You know, for someone with your degree, armed with this permanent residency and this amazing career path. What are you excited about?
I think that honestly, there's a lot to be excited about, which can be very overwhelming in the beginning, because like when you're coming from a background where you're only allowed to do one thing, it kind of forces you to stop thinking about other things. But I think that I'm most excited about figuring out how many things I can kind of do at once. Like, I have a lot of interest things that I've been thinking about, that I've been brewing. Like, as I mentioned, the mentorship, that's something that I've always wanted to formalize or create some form of guide for a lot of people, especially the people who are in schools or institutions or positions that I've been in. I feel the need to be able to make their lives easier coming in. And I personally had professional mentors at the graduate level, but before then I didn't really have anyone to really provide much guidance professionally. And so I want to be that person for other people. So I'm really trying to figure out how I can do more work in that space. But also I really do want to like go on with the work that I started, do something even more in that field, do a lot more in that field, but also explore my other interests. Like, as I mentioned, I'm getting a degree in project management. I really want to explore what that looks like for me, explore what more quality improvement work looks like for me. I have a certification in compliance, so like really explore what that looks like for me in the healthcare field, and really do as much as I can with the field that I am passionate about, because I have a lot of things that I want to do in healthcare. There's a lot of need, and so I really want to now be able to bring my knowledge, bring my expertise, but also learn a lot more from that field and help out as many people as I can along the way.
That's amazing. That's amazing. So thank you so much for sharing your experience, the challenges, the things that made your application pop. Do you have any last words to anyone who has this almost like identical story to yours profile, who is right now in school? I feel like people do better when they hear this message a lot earlier. You know what I mean? When they're not really burdened with the timeline, the ticking clock of OPT's ending. Oh my God, what am I going to do? You know, I think that when you're in school and you get this message, then you know what to do, right, to make your application stand out. But if you were speaking to someone who is right now back in the little town where you went to school in Pennsylvania, and that person is thinking about, okay, I'm in this public health program, I don't know what the future looks like, I'm really passionate about this stuff, and I want to stay in the US and continue this amazing work. What parting words would you say to them about things that could make the application for EB2 stand out, and as well as what advice would you give them for their career moving forward?
I would say my first piece of advice, which comes easier for me because I'm a person who does this without anyone telling me to, is save everything. So save good one. Everything that you can think of, even if you don't think it's necessary, you don't think it's that important, just save it. Save your emails, forward them to your personal email, save your everything that you can, save it all. Because I think that was one of the things that made this process less daunting for me, was knowing that I already had most of this information somewhere that was accessible to me. So I didn't need to do that much extra work to get it. So save everything. Also, public health is changing. The sphere is changing. It's getting more interesting. There's a lot more now to do with technology and tech. If that's something that interests you, focus in on that and really do what interests you. So find what in the field interests you and really pursue it. Like attend conferences, put yourself out there. I'm not really the biggest proponent for conferences, but if you can get a scholarship to go to one, then by all means do that. Talk to a lot of people. Even though I'm not really the biggest fan of them, I did find that they helped me meet a lot of people doing varied work in the field. And it also helps to inform the work that you're doing. So talk to people, meet people. There are a lot of groups that are available for public health professionals. So join as much of them as you can. Be active. Don't just let things happen. Be very active in trying to go out and seek opportunities within the field, because you can have a very uneventful career if you want to, but if you really do want to make a difference and see the difference that you're making, seek out opportunities and do things that really interest you. And even things that don't interest you, because you don't know what really you're good at or what's interesting to you until you try. So any opportunities that come your way, take them. You never know where that will lead you in the future. And enjoy your career. Like public health, at the core, a lot of us just want to help people. And so just go with that passion and enjoy the work that is available to you and the work that you want to do in the future.
Wow, that's amazing. You said a lot of things that, oh my God, I feel like I can write a whole motivational book just with all of the stuff that you said. So thank you so much, Terry. I wish you the very best in your career. I'm super proud of you and all the things that you've achieved. I know that the sky is just a starting point for you. You're going to be one of those people that will be pointing at the TV and saying, hey, I know her, you know, and I'll get to tell people that I wrote your petition for your EB2NIW application and you got it, you know. I'm really proud of all your achievements. Keep going, girl. I think you can do anything you put your mind to. Thank you so much for saying yes to share your story. I mean, I reached out to everyone who we've worked with, which is a ton of people. And not everybody wanted to, you know, it's a little bit tricky. Some people are like, oh, I'm kind of shy to talk about my story. But I feel like you're one of those people who said yes right away without even thinking twice. And so I thank you for that. I know that it takes courage to share your story, especially immigration is not something that a lot of people want to share. You know, because people have been burned. People have found themselves in situations where people judge you because you're on a temporary visa. You know what I mean? People think you're coming into this relationship because, hey, you're looking for a green card. And because of that, I mean, we'll post stuff on Instagram. We'll get like 2 comments on the post. But then people go in the DM and ask us so many questions. And I get it, because that's what immigration does. It makes people super self-conscious. Like, people don't even want to talk about it. And so when you said yes to sharing your story, I knew that, you know, it took courage to do that, and I appreciated the effort, and just you wanted to tell people, help people, because that's like, at the core of it, that's what you're doing. And so I appreciate you. I thank you for all the referrals that you've done and all that you're going to do in the future. And
definitely.
Please stay in touch. We really want to know what's going on, and you know, want to hear back from you in the future, you know, with what you're working on and things that you're doing. So thank you. And
thank you so much. Thank you for everything. Thank you for all the help, and just thank you for actually agreeing to take me on from the start.
You're most welcome. You're welcome.
Without that, I wouldn't be here right now. So thank you so much for that. And of course, I'm always happy to talk to people about it. Like, as you mentioned, like, it's a thing that you should be self-conscious about, but there's nothing to be self-conscious about because you're not doing anything wrong. So you should
be proud.
The more people that talk about it, the less mystifying it is, and you really help to like shine a light for people and show people that there is a path out, and it's you're able to do things that you have accomplished and use that to give yourself a leg up, and that's never a bad thing.
Yeah, absolutely. So I want to thank you guys for listening, and we'll see you on the next episode of the EB2NIW podcast. Take care. Bye-bye.